Welcome to Conversations with Student Health Service. I'm Danielle McSherry, nurse practitioner.
And I am Dr. Kim Frodel. We work at UW-Eau Claire Student Health Service and would like to talk to you about common birth control methods.
One of the most common options for birth control is a combined oral contraceptive pill. This pill that contains both estrogen and progesterone is taken every day. Most have 3 weeks of active pills and 1 week of placebo pills. This week is when a patient would have a withdrawal bleed or menstrual cycle. These pills provide good birth control, but can also help with premenstrual symptoms such as uterine cramps, irregular menstrual cycles, and acne. They work best if taken at approximately the same time each day.
If remembering to take a pill is a concern, NuvaRing is an option. This is a small plastic ring that is inserted into the vagina and left in place for 3 weeks. It is then removed for a week to allow a withdrawal bleed or menstrual cycle. A new ring would then be inserted. This form also contains estrogen and progesterone and is like the combined oral contraceptive pills.
If a person cannot take estrogen due to a history of intolerance, migraine with aura, or blood clot, there are several progesterone-only options. One is the mini pill. It is taken every day. Periods may occur once monthly, or may be irregular. It is important that this pill is taken at the same time every day.
A second progesterone-only option is Depo-Provera. Depo is a shot in the arm that is given in clinic every 3 months. Periods often stop with this form of birth control. Side effects can include weight gain, acne, mood swings, and decreased bone mineral density when used for more than 2 years. A similar form of birth control is Nexplanon, a progesterone-only plastic rod that is inserted into the upper arm and stays in place for 3 years. It is excellent birth control, but can lead to unpredictable periods. Most patients report the same amount of bleeding, but note it is irregular.
Progesterone-only intrauterine devices, or IUDs, are another option. This type of contraception is inserted into the uterus and is a procedure that is done in student health service. It provides birth control for 3 to 5 years. Periods usually become lighter and may stop. They are associated with uterine cramping at the time of placement, but taking a dose of ibuprofen prior can help. A hormone-free option is Paragard, or the copper IUD. This stays in place for 10 years. Periods tend to stay the same or may be slightly heavier.
Student Health Service offers various options for birth control. These include combined oral contraceptives, NuvaRing, Micronor, Depo-Provera, Nexplanon, and Kylena, a progesterone-only IUD. Students enrolled in the Family Planning Only program can access all forms free of charge with the exception of Nexplanon. Certain types of birth control can be purchased from our dispensary at $18 a month. Prescriptions can also be sent to an area pharmacy.
To schedule an appointment to discuss birth control options with Student Health Service, students can call 715-836-5360 or can book online by accessing the My SHS login on our website. There's no charge for these visits.
Thank you for listening to this episode of Conversations with Student Health Service.